Hey y'all, welcome and welcome back to my channel. And if you're new here, please subscribe. It supports me. If you're already a subscriber, thank you very much for checking in. I do appreciate. Well, today I'll be talking about the pandemic. Yeah. Well, it's so bad. It's unfortunately that this pandemic is taking too long, longer than we thought or we ever anticipated. Well, and unfortunately it's not getting any better, it's getting worse because of the variant and because of us, people like us who don't wear masks, people of us who don't take it serious, like people like us who are so ignorant. That's why this thing is taking longer than it was supposed to be. Anyway, I really want to talk about the Delta variant, because normally I work in a hospital and it's getting crazy over there. It's really getting crazy and I'm really serious about it. We being pushed to where we were before, where we were like overwhelmed. We're having patients, so many patients, and when they come in, it's COVID, I can't breathe, I have chest pain, I have this pressure, I'm feeling this and this. It's getting serious, and it's really getting to this point because of us being ignorant. Like something simple like washing your hands. If you're in public, maintain social distance. If you are accessing social amenities, wash your hand, sanitize. People, we becoming so ignorant. People no longer wear a mask, and if they wear a mask, it's like hanging over there. What's the point of you wearing mask if you're going to put it hanging, or if you're going to pull your mask up to here? Then when you see, like back in my country, when you see there's an official government like police, then that's when you put your mask. What's the point of you? Are you doing this for yourself, or you're doing this for the government? Are you doing this to protect yourself, or you're doing this just because it's required? People, let's get serious. And I'm saying people, let's get serious. People are dying. People are succumbing to death, to this thing, deadly monster. And because people are saying it's just like a flu, it's just like a flu, it's just like any other, it won't get me, or it's not going to get my people, my family. Yeah, like that's how people are thinking, and that's not the case. Young people are dying, young people are getting sick, and it's getting serious. You see, like, go to the hospital, see ICUs. Not like you see, before people were saying it's all people, those people who have underlying condition. Right now, whether you have underlying condition or you don't, if it's coming, it's coming. If it gets you, it gets you. So take precaution. Those places whereby you think it's, if you don't need to be in social social activities like out there, be at your home. What's the point of you attending a wedding? What's the point of you attending a ball game? What's the point of you attending something social out there, and then you come back with a disease, with a virus, and then you end up in the hospital, being hospitalized, risking your own life? What is the point of everything? You can hold everything, like, for now until things get back to normal, but as long as we're having this thing, please, there's no point of, especially if you know you're not disciplined, because most of us, they're so indisciplined. You're out there and you know you're supposed to be having your mask, and you don't wear a mask. You are out there in a very crowded place, you're walking freely, breathing in oxygen, and you know some people, they breathe like this. It's like this. Of course, you know, when you breathe in and you breathe out, don't think that when you breathe out, the air you breathe out is dry. It's not dry. Already it has gone through you, so it has been moisturized, it has attracted, it has gone through your lungs, and you see the COVID, it's in your lungs. So if somebody is sick, is sick, because some people, they are carriers, they are sick and they don't know. they don't have any symptoms. So you are there out, somebody has breathed in and is breathing out, and so everything that has been in him, like this oxygen has gone through his lungs, through his blood, it has carried all the germs in his system, and then he's breathing in out to you, and you're there, you're breathing in all his germs. So people, when we are asked to wear a mask, there is a reason why we are being asked to wear a reason. I know it's very uncomfortable. Like for me, for instance, my skin breaks out so much. At times I'll be there breathing in, I'm like, oh, it smells bad, because you don't feel that fresh air. Because of course, you see, when you breathe in, when it goes through your system, it's coming out with carbon dioxide, that is CO2, and any other gases in the system and everything. You don't expect that to be smelling nice. So, and you are forced to be like, kind of, you're breathing it back again. But it's better off, it's better for you to have your skin breaking out and all that stuff, but be safe, be alive. So anyway, most people, they are doing this. Some people, they're not even getting the vaccine. Like it's such a shame, especially here in America, because vaccines, they are out there freely. Like almost in every corner we have vaccines. Even there was a point that people were being paid. Can you imagine? You're being paid $100. You're being given gift card for $100 just to be vaccinated, just for your own health. And when that time they were being given, I was like, and why did I get my shots earlier? I should have waited if I knew they were going to get the vaccine. And even after that, some people, they never got their vaccines. Yeah. And so when you are sick, when you get sick, that's when you are rushing to the hospital. If you don't believe in this vaccine, you don't believe this COVID exists, then when you get sick, stay in your damn house and die from there. If you can't take vaccine, if you can't take precautions, just stay in your house and die. Don't go there rushing to the hospital. Now you want you want the medical attention, yet all along people have been preaching. The pastors, the politicians, everybody, they have been preaching, take this vaccine, take this vaccine, take this vaccine, and you guys, you don't want to take the vaccine. And then when you get sick, you can't breathe, you can't do that, that's when you're rushing to the hospital. And then the hospital is overwhelmed. Even these nurses taking care of you. Don't you think you are risking even their own lives? Most nurses, they have their shots, but people are still getting sick even if they have shots. Anyway, what I'm trying to say is this: people, let's be serious. Go get, if you are eligible, go get your shots, please. If you care about other people, there are people who cannot be able to take a vaccine, and these are children below 12 years. They can't take the vaccine because we don't. Then the doctors, the system, they don't have the vaccine for them. So that's not their fault. So, and you know, the generation of, we have so many children. So if person like me, old like me, can take a vaccine, how am I going to protect my son? How am I going to protect my nieces, my nephews, the kids out there? How am I going to protect them if I can't take vaccine? So people, somebody like the Dr. Scott Robertson, he is the president and CEO of Political Central Coast for Health Center of Dignity Health, says that mRNA for Pfizer and COVID is both, they're good for, they're both good to take. So I don't know why people are there trying to politicize, saying that they are not safe, that you're going to succumb. They are safe. Then they're incredibly safe. They are safe for you to take, and it's extremely safe for you to take, because the aim of these vaccines, it's not Yeah, it's to keep you safe. It's to keep you when in case when you get the when you get the COVID, yeah, it will keep you like from getting that, from getting sick, that serious sickness, or being like overwhelmed by this. At least it's a booster, it's boosting your immunity. It will be able to fight that way. It will keep you from dying. People who wanna die, one thing I know is that I'm not ready to die. One thing I know is that I'm ready to live, and I want to live for so long. That way I can see what will be there in future. That way we can say there was a time we had COVID and it took away so many people. Some they were innocent, some they were innocent. Some they were just the ignorant who were going out there partying, and then they come back, they are sick, then they are rushing to the hospital. Yeah, so I think I have summarized something here. It is extremely effective, especially in preventing severe illness and death. So please, guys, let's take this vaccine. If you're eligible, please take them. Then the other thing is that who shouldn't take this vaccine? As I had said earlier, children below 12 years, they cannot take other vaccine because there's no vaccine for them right now. They're still the process is still I think it's in it probably in the third stage, fourth stage, some in their first stage. That is Moderna, Pfizer, Johnson, and other things, and other companies that are trying. So please do your necessary. The other people who cannot take the vaccine, these are the sick people, like extremely sick, and they have not the heart conditions. These are people that maybe they have the chest problem, the lungs problem, they are having issue then. So these people, they cannot take the vaccine, but that doesn't mean that they have been excluded to take the vaccine. As long as they're going under the medication, these people, they cannot take the vaccine, because what's the point of to make it worse? So these people, they're excluded. But once they feel okay, once they are better in terms of health, then they are advised to go and take the vaccine. The other group, if you're and let's say if you're having maybe treatment, like the cancer patient, and they're having the chemo treatment. You see, most of this chemo is acute, and your immune is down and everything. So when you're at that stage, you can take. So you have to go through your chemo, and once you're done, then you can come back and take your vaccine. The other people who cannot take the vaccine, these are people that had a previous reaction when, for instance, when taking the flu shots. If they have those extreme reactions, the COVID, when they had before the COVID vaccine, and they had a reaction, these people, they cannot take the vaccine, and because they might end up being hospitalized or having problems. So, and that might interrupt maybe their breathing system. Yeah, so these are the people that they cannot take the vaccine. But if you're having diabetes, if you're having heart issues, if you're having I don't know what, you need to be the first one to take this vaccine. You need to be rushing. You rush like this, go to where they're giving those shots and get your shot, because if COVID come and attack you, it might knock you down, because you see already you have some condition. So you need to protect yourself. Yeah, pregnant women, yeah, Moderna is very effective. It's not going to affect your pregnancy or anything. So many people here, like I've seen even back at work, nurses, colleagues, so many people, I've seen them taking the shots. So It's not like, because some people they say I'm pregnant, I cannot take. It's safe for it's safe for you guys, for even pregnant women. So people, as just want to urge you, please, if you're eligible to take the vaccine, please take it. At least when you take, you're protecting the young ones less than 12 years. You're protecting those people that are really sick, that they cannot take a vaccine. Imagine yourself, you're there and you're having this patient, maybe it's a family member, it's whoever you're taking care of, and maybe he or she is going through the chemo, and you see now they can't take the vaccine, and you're there, you're taking care of them. Then in your process of up and down, you go, you get the virus, and in the process of taking care of them, you infect them with your virus. The probability of them getting dying is very high. And who will be the cause here? It's you. Whose fault? It's you. So people, let's be responsible. People, let's take precaution. People, let's do what's right. Let's use the common sense, because you see, most people out there, they don't have the common sense. They don't do the necessary thing. They just politicize everything. Like over here, people are politicizing. Let me tell you, like the publicans, most of them, they are refusing to take the vaccine. Why? Because Trump doesn't support it. Yet Trump himself, he got his vaccine even before he was out of the, the moment he got sick and he was treated and all the stuff, he got his shot. And people out there, because Trump doesn't, he's against it, everything. So people are there refusing to take the shots. People, be serious. This is your life. This means, like, is politics more important than your own life? When you go back to my country, that's even worse. Then they get funds for COVID and everything, and it's being misused. It goes to other people's pocket and not to the right channel. And it's such a shame, because there's a country, there's a leader, there's a president, but of course he's overlooking everything. Anyway, I just want to urge you, please, I want to urge you, take precaution. Take COVID if you are eligible. For instance, me, back at hospital, it's getting crazy to a point that we have been given notice that from a certain date, if you haven't gotten your full shot of vaccine plus a flu shot, you won't work. So you need to go and take your shot. That's the condition we have been given at work. And if it comes to the worst, we may be asked to get a booster shot. You can imagine, you are going to get a booster shot and there's somebody out there who hasn't even gotten the first shot. Is that even serious? Because we are dealing with sick people every day. Like, there was a time I went to the hospital and 80% of the patients there, they were COVID. There was a day, I think 2 days, like this week, there was a time within an hour we lost like 3 patients due to COVID. Within an hour, the hospital is being overwhelmed to a point that in the lobby, the downstairs, on one section's lobby, the hospital, they did set that apart just in case of emergency for COVID patients. That's how it's getting serious. And there are people out there walking freely, not even caring, not even minding. But when they get sick, they are rushing to the hospital. People, your life is more important. So if you get a chance, if you're eligible, if you want, I know I've been repeating this over and over and over, but to some people, you have to repeat something over and over. It's like a song. It's like kids, you have to repeat it over and over and over and over for it to stick in their mind. Anyway, I don't want to say much. All I want to say, bye-bye, and please be responsible. Thank you.